Today, we are welcoming you to the Efficient Documentation webinar, but we want to go ahead and move forward with introducing our speaker of the evening. So tonight's presenter is Dr. Oji. She earned her master's degree at University of Texas Health Science Center in Houston, and she earned her doctorate from Duke University in North Carolina. She is currently a family nurse practitioner and applies her extensive simulation education background in the classroom to teach excellent and precise hands-on skills. Her passion is helping advanced practitioners and students build confidence in learning procedures and clinical skills. She is a follower of Christ, and her worldview is based on biblical principles.
Well, thank you so much, Amelia, for that wonderful introduction, and welcome everyone. I look forward to a beautiful evening together. And yeah, we do have a lot for you. So just stay tuned, okay, guys?
Now we'll let you know a little about us, starting with our vision statement: to revolutionize advanced practitioner continuing education practices by providing excellent, useful, and accessible educational content, leading with integrity and passion for excellence to honor God and our customers. And our vision statement is that we empower nurse practitioners, physician assistants, and striving NP students to learn concrete, relevant procedural skills to practice confidently in healthcare settings, reflecting Christ with every workshop we deliver.
And also, as you're going through this webinar, we have a few questions for you to ponder over. So, firstly, how confident are you in your ability to document accurately while maintaining a smooth and timely patient workflow? And are you familiar with strategies to improve your work RVUs without increasing burnout or compromising care quality? How effectively are you using your care team to support documentation, patient communication, and visit preparation? And are you comfortable incorporating tools like AI scribes or dictation software into your clinical practice while ensuring patient safety and compliance? So, as you're listening throughout the webinar, start to ruminate over a couple of these questions and see kind of where you land.
Now let's dive into the agenda. Today, the topics we'll be discussing are efficient documentation / pre-visit planning. Then we'll get into faster documentation, leading into protector practice, followed by boosting your RVUs and closing out an AI in practice.
Yes. So for today's goals, we want to teach you efficient documentation and clinical communication principles that will greatly impact your patient care and professional accountability. We also want to provide you with practical tools and strategies that simplify your workflow, support compliance, and help you make accurate, defensible clinical decisions in everyday practice.
All right. Well, welcome everyone, and thank you, Amelia and Kiana, for that wonderful introduction to the webinar today. So again, I always start out by talking about documentation in terms of how to protect yourself legally as a nurse practitioner. And of course, we may have some physician assistants join us tonight. So documentation does provide information on patient flow. It does help you with better communication between healthcare providers. So again, with each patient visit, you know that if it's not documented, it's not done. So a couple of things that will be important is when you're, think about whenever it is that you're documenting that someone should be coming behind you, because of course you would take vacations. There'll be times that you're out of office for, PTO, and somebody would have to fill in for you. So when you're documenting, always think about that. Also, think about the fact that medical records play an integral part of receiving proper reimbursement, especially for the new grads in the room. This is really important for you to know that what you document does play a huge role in proper reimbursement for the services that you provide. And then, of course, your documentation also helps with treating high acuity patients and medical decision making, typically justifying the higher billing code. So you all know about billing, the 99213s and the 99214s. You have to document in such a way that you can bill a 99214 or 215. And then, of course, you want to maintain accurate and detailed medical records. That's really important. So again, whenever we talk about protecting yourself against legal liability, your documentation actually would do that for you. So again, you want to clarify your thought processes. Also clarify, think about, God forbid, if anything ever goes wrong and your documentation is put out there by some attorneys. Think about the fact that you also want to clarify their thought processes and management that you provided. And so what happens with most of those documentations that we talk about would be, 2, 3 years into practice, sometimes 5 years, 10 years, you're not even sure when you had seen this patient. And so always think about maintaining the accurate and detailed medical records in such a way that if a provider's chart is scrutinized in a lawsuit, the care you provide could be evaluated. Just think about the fact that your documentation could be read by the CEO of the company where you work or the state medical board rep. And then, of course, this also can be projected onto a large screen in a courtroom by a jury. Again, this is not to scare you or anything, but it's just to really get you to a point where you see documentation as a big part of what we do as NPs, and of course, as providers in general. So I did put the slide here because my team and I put the slide together because we felt like it's important that you start thinking about documentation from the pre-visit. So again, before the patient even steps foot in your clinic, that your team is already thinking about the visit and coordinating the care with you. So again, always think about reviewing records. So if you've ever been in any of our classes where we're talking about X-rays or EKGs, you know that I always talk about, trending. So looking back to see what records were there or already. So was there a previous EKG? Was there a previous X-ray? So reviewing records and anticipating the needs always will streamline the visit and reduce the delays. So for example, the blood work, so let's say a patient comes in to get their A1C checked. You always want to make sure that you go back and take a look at the previous labs results, because that way you're able to, identify where the A1C is, if there are any care gaps that you need to fill for that visit, and then of course, treat this patient based on what you have in front of you. So enhancing documentation quality is really important. The team-based input, of course, would ensure accurate and complete notes and reduce provider burdens. So pre-visit planning also supports your proactive care. So again, like I talked about, pre-visit labs, screenings, and patient concerns are also addressed before the visits. So again, this would improve health outcomes. I know in the clinic where I work, sometimes you have patients that would ask questions about, well, can I just get some blood work done before the annual well visit? And this is real good practice because that way you can spend the time during the visit discussing the patient's labs instead of just ordering the labs. So again, these are all important concepts that you want to think about and hopefully incorporate into your practice. And then you also want to plan ahead. So strengthening the continuity, again, I talked about whenever it is that you're maybe out of the clinic, you always want to plan ahead by including scheduling. Think about the fact that when you see the patient, you may want to see them again in, let's say, 3 months. Or 6 weeks, again, depending on what the disease process is. So again, strengthen the continuity of care, plan ahead, include the scheduling for the next visits, keep this patient engaged, and keep them on track for their care. So again, pre-visit planning is priceless. And then when we talk about team-based documentation does support efficient collaborative patient care. So your medical assistants and your nurses can always document the patient concerns. They can review meds. They can verify allergies before the visit. And of course, the pre-visit planning should also include, like I said earlier, reviewing records, ordering labs, updating health maintenance, gathering necessary forms. And you as a provider would just go ahead and review and sign off. And this would really help with streamlining that visit and improving the workflow. So when we talk about efficient documentation and communication, the first impression matters. So the first 3 to 5 minutes when you have this patient right in front of you with the patient interaction often will reveal the diagnosis because again, you're able to, visualize the patient, you're able to see the nonverbal cues, you're able to, actively listen to what is going on. And these are all critical in making that first impression. So again, better communication with the patient equals better notes. Think about the fact that empathetic and clear communication and conversations with your patient would always lead to you documenting accurately, which of course will reflect the full scope of the encounter. So one thing I want to tell, especially the new grads in the room, and I tell this to my students all the time, avoid sparse notes. You don't want to document vaguely. You don't want to say doing well in your assessment and plan, records. You always, in that section, you always want to make sure that you write in a way that anyone that has to follow through after the visit that you completed can just follow along. So think about it. Doing well is really vague. Continue meds. What meds? Are you continuing? If a patient is on 4 or 5 meds, are you continuing the lisinopril? Are you optimizing the lisinopril from 10 milligram to 20 milligram? So again, you really want to avoid sparse notes. Failure to capture is also something that you want to think about, being able to capture the care that you provided. Because again, when you document sparsely, this is really what it means. It means that you're not capturing the care provided. So detailed documentation protects both you as a provider and the patient. And so again, lastly, with the efficient documentation and communication, you want to know what to include in your documentation. So documentation should reflect what was medically necessary. So we talk about patient acuity. You want to talk about quality reporting, coding data, nothing more to ensure accuracy and compliance. Sometimes the patient is talking about other things that are not real relevant to the visit. Make sure that you're just including what is relevant for that visit and what is medically necessary for that visit. All right, we're just going to switch gears and talk about faster documentation. So documenting smarter and not longer is important. So I did talk about efficient documentation. The time, always make sure that you time yourself, especially when you're starting out. I see in the chat box when we started this webinar tonight that there are lots of new grads in the room. You want to time yourself during a new or complex visits. It might take a bit longer, of course, but it pays off in documentation clarity and reducing errors later. Quick hacks, and we do have a few quick hacks to kind of look at together. They are built really to help you streamline routine documentation. So again, you're freeing up your time for other responsibilities or to end your day earlier. So the clinic where I work, I did, and I'll tell the new grads this all the time, that the very first time that you're, you get your new job, you're starting out, and you're during orientation, that's the best time to actually, get all of your autofill and your text expanders and your, dot phrases. You want to get all of those things done, the macros, right? So when you're documenting directly into the EMR, that really saves you time. You really don't have time to go document on a sheet of paper and then go back and start retyping. Just make sure you have your workstation in the room, the patient's room. Again, that's what we do with the clinic where I work, the Memorial Hermann Medical Group where I work. Basically, what I do is I just go into the patient's room, the computer, the workstation is already in the patient's room, and I just scan my badge. That really saves me time typing in my password every time I go in and out of a room. So scanning your badge is a good one too. And if you're not already doing that, that's something, a conversation that you may want to have as well. So again, make sure you document directly into the EMR while the patient is there with you, okay? Because what that does for you is really to reduce time that you spend retyping or recalling details later on. And then I talked a little bit about autofill and text expanders. These are tools that should be in the EMR. And what it does is really to cut the repetitive typing and reducing redundancy in your notes. So I do have an example of a macro that I use. And of course, you can always get this from other providers in your practice. For anyone that uses auto text, just go ahead in the chat box and put auto text for me, so I know you're using it. And if you're not using auto text, just let us know, because I'm definitely going to share this with you. If you're using auto text or macros, put in the chat box using auto text. And if you're not, then we definitely have to have a conversation. So for the new grads in the room, you want to create macros during your orientation period. This will really save you a ton of time. So this is an example of a macro or auto text, however you want to call it, right? Or the dot phrases. So for the HBI, take a look right here. Dot HBI, patient is, you just put an age right there. Again, you customize this based on the patient in front of you. So this patient is here to see you, a male, female patient, then you choose which one it is, presents with a chief complaint and duration. And then, of course, you can use this template for every single patient that comes in. And this will really save you time versus trying to typing, all of this notes for each visit. And then, of course, for the review of system, the review of system is pretty standardized. It's just really a few tweaks based on the patient in front of you and the chief complaints that they're there for. So you definitely want to make sure you have an auto text for the .ROS. Okay, again, you can see that right here. For the physical exam, the .physical exam, you can kind of see that. Again, it's not very different for every patient. Every patient requires a cardiovascular assessment. They require a lung assessment, so respiratory assessment. So you can see that this would not vary too much for most of your patients. All you're doing is, let's say the patient is there for low back pain, you want to document a whole lot more with the MSK section. If a patient is there for, let's say, HENT, then you want to make sure that you're documenting a whole lot more in the HENT section. So you must everyone has to create a macro. And the best time to create a macro would be during your orientation before you actually start work. And then for the assessment and plan, again, make sure that you have the dot phrase for every single diagnosis. So this will be like the .AP assessment and plan for hypertension. Take a look at this real quick. So hypertension, the blood pressure today, you can kind of put that in there, continue the meds, so whatever medicine the patient is on, lisinopril, HCTZ, whatever it is, you want to make sure that you add that to this context right here. And then this would really help you also with even the patient education. So reinforcing low salt diet, exercises, labs reviewed. So your dot phrases should be created. The time that it takes you to create the dot phrases is definitely not time wasted at all, because that would really make your documentation go even faster. I want to say this, but I also want to talk about AI, and I'll talk about AI later on in the presentation. But even with the AI, you still want to have your dot phrases because with the dot phrases, especially with the assessment and plan, you want to make sure that you're really creating your own assessment and plan and reviewing what the AI puts on there. And we'll talk about that a little later. So I just wanted to kind of tell you that's coming up as well. Okay, so let's switch gears and talk a little bit about your HBIs and review of system efficiency tips. So make sure you're using old cards. Old cards has to be used for most of your patient encounter. Think about a patient that comes in with URI symptoms, pain. You always want to ask questions about the onset, the location, duration, character. Are there any symptoms that actually make the factors that make the symptoms better or not? Timing, severity, all these are crucial. And what happens if a provider is not using old cards, you find that documentation is really sparse. So make sure that you have it, get a dot phrase for your old cards, make sure that you put in an old cards for every single visit. Again, you have to modify it based on the patient in front of you. Sometimes it's not real full, like let's say mental health patient comes in with anxiety, depression. It's possible that you're not using a lot of old cards, but for most of your patients, you're using old cards. And then the short structured phrases that are better than long narratives. You always want to keep each symptom separated with headers. So again, I work in internal medicine, so I always would have, let's say, diabetes in one section. I have hypertension in another section. So with the diabetes, I have everything related to diabetes. So A1C, the last A1C, I would talk about the patient's meds that they're taking. I would talk a little bit about, any symptoms of hypoglycemia, anything else that is going on with the patient, their diet. I would talk about exercise. I would talk about, do they have any symptom that I want to kind of address? So that would be something that you want to keep in mind when you're documenting with the ROS. Remember, ROS is subjective data. That is what the patient tells you. So make sure that you have that with the HBI and the ROS as well. And then before the patient even enters a room, use the pre-fill questionnaires to gather the review of systems before they enter that room. So again, this is where your support staff is helping you gather the data while the patient is waiting to see you. This will save you several minutes of interview time. And again, you can just clarify a few things on the questionnaire with the patient in the room. But again, remember that your time is real valuable in your day, because again, these little pockets of time that you save would add up in the long run. And then we talked about templates. So again, your templates really helps standardize the approach. It would reduce the chance of you missing any elements, adjust the template slightly for each patient instead of starting from scratch. Again, these are real crucial steps that you want to take while you're documenting. For physical exam and time-saving templates, the physical exam documentation covers objective data. So this would be your assessment. Would be what you actually performed. It does not have to be rewritten each time. So use templates for routine visits. Many of the EMRs allow you to insert the automatic list of diagnoses and related orders. So again, this will help you build your assessment and plan quickly. Always use adopt phrases like we talked about. These are shortcuts that will really help speed up your physical exam charting and remind you of key items to assess or order. So again, you can think about it. Your dot phrases would actually help you to ask questions with the review of system, and then with the assessment would also help you to assess so you don't miss anything. And then lastly, I want to talk about completing your notes the same day. I've talked to a few NPs, especially the new NPs, that have told me that they have a backlog of notes. They have up to 2 weeks backlog of notes. This is something that you don't want to do. You always want to complete your notes the same day. Closing documentation within 24 hours does improve your billing. It protects you legally and it prevents backlog. Because again, once you start keeping notes for, 24, 48 hours, what that does for you is really you have your office manager just hounding you and saying, well, we need the notes completed, we need to get billing done and all of that. And you really don't want that. You want to make sure that you are completing each note, your notes the same day. And so when we talk about delegation and messaging and refill protocols, educate patients to use the secure messaging portals. For those of you that have EMR systems that patients can actually message you directly, I know Epic uses that. We use Epic. If you do not have a messaging portal, this will really is something that a conversation that you want to have with your employer to say, okay, well, is there a chance that this can happen sooner than later? Because what happens instead of calling the patient, of course, there will be times when you have to call the patient, but the patients for, let's say, refills or, okay, well, I want to make an appointment because I feel I have a UTI, instead of, getting on the phone and making those calls, they can just quickly message you. The calls and all of that do interrupt your day, and they think about protecting the patient's privacy. So again, these are all important, just little tweaks that you can make in your day that will be real helpful overall. And then aim to respond to patients' emails within 24 hours. If you ever get an email or a message from the patient, I talked about the secure messaging portals. Within 24 hours, make sure that you're responding to the patient's email. I've also asked some of my new grads, because again, I teach at the University of Texas, but for some of my new grads, I always ask them during the interviewing process, can you ask for an admin day? If it's possible to add maybe just one day that's your admin day, where you're just, replying to emails, refilling, medications, and, talking to patient, communicating with patients, those will be really helpful. But if you don't, then you have to make the best of it. I do not have days that are just, refill days or admin days. So again, refill requests should be handled by your medical assistants using protocols. Of course, the narcotic recall request should be routed to you directly as a provider. And then delegate communication, documentation, and refills whenever appropriate to your care team, so that way you can really focus on clinical decision making. So again, when I talk about documentation, I don't mean your charts. I mean documentation of all of the pre-visit templates that the patient completed. Make sure that you're reviewing those, and of course, your support team should be helping you with those type of assignments. Going back to the presentation, you definitely want to document in such a way that you're protecting your practice, okay? So when we talk about documentation and legal protection, you want to know a couple things. Incomplete or missing documentation is one of the top reasons for NP sanctions. Not just NPs, providers in general, and of course, malpractice lawsuits. Every visit note must be signed timely, and it has to be thorough. I'll give you example. So the other day I had a patient that had come in for a blood pressure check. So this patient had seen another provider in our practice, and she had just come in and she was my patient on that day. And so again, I was just following up on, blood pressure meds, refill. They're still trying to optimize the blood pressure to see if this was something that the patient would tolerate and so forth. And so I went back to take a look at this provider's notes, and the assessment and plan section was completely cut off. And I was like, okay, well, was this maybe prematurely closed? I wasn't really sure what was going on, but just did not see. So she started with HPI. She did a review of system. I saw a little bit of a physical assessment, but I didn't see all of it. But the assessment and plan of this documentation was completely missing. And so you have to be real careful not to close. Of course, if you close the notes spontaneously, sometimes it happens inadvertently, not really knowing that maybe you're in a hurry or what have you. You need to go back and addend that note and make sure that you complete your note. So again, like I said earlier, you always want to document your own assessments. Even though, for example, I can give you a few examples of how your medical assistant maybe just goes in and does a ceremonial lavage on your patient, comes back. It's still your duty to go back and document what was done because this was your patient, and you just delegated that task for your medical assistant to perform. So you want to make sure that you're documenting not just your assessment, but discussion with colleagues. Sometimes we're curbsiding with the ER. We're calling the ER physician, the ER nurse practitioner to say, well, I'm sending the patient in. Make sure you document it. Even if it's just calling the patient for blood work, make sure you document that you had the conversation with the patient. And then you also want to document your rationale for clinical decisions. This does protect your license and your professional credibility. Do not sign off on documentation or tests you did not personally perform. Please don't sign off on even if it's a student that performed that. Make sure that you wrote that it was a student that performed that under your supervision. Make sure that even if it's let's say a colleague that maybe had seen a patient, and maybe both of you had seen this patient in different visits, make sure that you document what you did personally perform, okay? Because that's really important. This does create a legal liability and undermines patient safety. And then lastly, on this slide, you want to make sure that you're maintaining accurate, timely notes, and not just your administrative task, but you always want to think about, okay, well, the direct reflection of your clinical judgment and professionalism, because these are all in question when you're documenting. So again, when you're documenting, always think about legally protecting yourself. And so when we talk about avoiding malpractice pitfalls, you want to follow up on all test results and communicate outcomes with patients, good or bad. Always document these conversations. I'll give you an example. I had a patient the other day. This patient was in his 60s. He had come in previously, not to see me, but he had come in to see a urologist. And the system where I work, we're able to see the specialties. We can see the ER. We can see when patients are in the inpatient settings, all of that. Well, this patient had gone in to see a urologist, and the urologist had ordered a urine culture, but the urologist never went back to look at the test results. And so this patient, of course, had not just E. coli, he had Proteus mirabilis, he had other things in his urine that required some antibiotics. He never got the antibiotics. So by the time he rolled around to see me, the patient was already in full-blown pyelonephritis. And so again, at the end of the day, it's crazy because this patient was sent to the hospital because he was spiking a fever. I was actually worried about sepsis at that point because he had other comorbid factors. But again, the urologist dropped the ball on this patient. The patient had to eventually get a renal stent. So again, these test results need to be followed up right away. And again, everyone's got their protocol. My practice where I am, ours is a 24, 48 hours time frame. You need to communicate the outcomes with the patients, good or bad, and you always want to document these conversations. So again, if the diagnosis is unclear, you want to schedule a recheck, refer the patient out when appropriate, and of course, knowing that your high-risk patients need timely specialist follow-up. Other things that you want to think about with malpractice pitfalls will be being present during the office visit. Give patient your full attention. Avoid interruptions. Sometimes you have your medical assistant going back and forth, you definitely want to make sure you're avoiding interruption so you don't, you're really fully present for the patient. Patients notice these things. And of course, you want to involve the patients in your decision making. This would definitely reduce the malpractice lawsuits because the patient feels like, well, you're involving them in your decision making, but you're also fully present and giving them your full attention during the visits. And then never criticize another provider in your documentation or even with a patient interaction. That always leaves a sour taste in the patient's mouth. Keep communication professional and patient-centered. So these are some clinical documentations, do's and don'ts. You never want to erase or alter medical records after the fact. I say this because, again, what has happened in the past, and I've read a little bit of the malpractice lawsuits that have happened to nurse practitioners when we're building our protecting your NP license CE course. Never erase or alter medical records after the facts because this could look really bad, especially with the attorneys when they're wanting to see the notes. It's almost like you're trying to hide something. If a correction is needed, document the date, the reason, and what was changed. That would be really important. So never erase or alter medical records. Avoid being judgmental or labeling the notes incorrectly. For example, documenting a substance use disorder when it's not clinically accurate. Again, what you're really doing would not be pleasant because remember, now patients are able to also review their medical records. So review and update agreements with your supervising physician. If you work in a state where you need a supervising physician, keep access to current clinical references at all times. And then lastly, on the slide, you want to make sure you're watching out for errors, okay? 1 digit off in a dose can have serious consequences. Think about 150 milligram versus 1500 milligram. So again, watch out for errors in your clinical documentation. All right, well, we're going to switch gears and talk about boosting your RVUs. For the new grads in the room, RVU would be a revenue value unit. You want to understand the RVUs. You want to know what your productivity report looks like. So if your employer does not provide you with a productivity report every quarter, or if it arrives late, you want to request for it. You need this data to understand your value as a nurse practitioner, as a physician assistant, as a provider, and it does provide you opportunities for growth. You also want to learn to measure your own RVUs. This is critical in tracking your performance and negotiating compensation. For example, a 99213 visit earns about 1.3 RVUs, while your 99214 will earn about 1.92, which again is slightly higher. So even small changes in coding accuracy and visit types can significantly impact your RVU total and your income potential. So again, we do have a coding course if it's something that you are really wanting to delve into, the billing and coding. We do have a course that would help you. And of course, we do also have a course that would help you with just knowing about your RVUs. All right, so strategies to increase your RVUs, increase new patient visits. I see a lot of providers that after a while, 2-3 years in practice, they close their panel and they say they don't want to see any new patients. New patients do carry higher RVUs. So think about your 99204 versus your 99214. So again, you always consider reopening your panel if it's closed, because maybe you just didn't know that that was a fact. And then you want to add billable procedures like your joint injections or skin procedures. These would expand your scope and boost your revenue. The joint injections, we have nurse practitioners and physician assistants that come to our live workshops, really just to increase their billable procedures and their a higher RVU. So joint injection is one that is really, it does really have a good RVU. And then, of course, improving your coding and documentation accuracy to prevent undercoding, and you want to maximize it visits RVU potential would be really important as you move along in your practice. And then you want to optimize visit length. For example, to reach 30 walk RVUs per day with 1.3 RVU per visit, you have to aim to see about 23 patients in 20-minute slots. So again, there are strategies to increase your RVUs. And if you need more information on that, we can I can answer those questions at the end of the webinar. So we're just going to move on and talk about AI. Artificial intelligence scribe system can transcribe, summarize, and even interpret your clinical conversations. So I'll give you an example of how we use AI. So in the practice where I work, basically what it is that you have the AI, we have the scribes, the different systems. And what it does for us is really that you can use your phone. So you're just going with your cell phone into the patient's room and just have a conversation with your patient. So what you're doing is really having a conversation like you have a nurse practitioner student in the room. So you're just going to ask questions during your review of system. You're really talking to the patient and saying, okay, well, asking the patient questions, and the AI is recording all of that conversation. With a physical exam, the same thing. You want to make sure that you are verbalizing what you're doing. Now I'm auscultating your lungs. Chest is clear. Now looking in your ears, and I see that you have some bulge in TM. All of that type of conversation, the AI is just recording that conversation. And so after the visit, then you can just go back to your workstation in your office, and you tap there's a little link that you tap, and that just downloads the whole visit, okay, to your notes. So it just downloads that directly into your notes. So again, it's a game changer. It's really going to save us a lot of time in family practice. I'm so excited for it, but I want for you to kind of listen up, okay? Before you're like, okay, well, no more documentation. Not exactly. AI scribes can alleviate the workload for clinicians, as many clinicians have found AI systems to be user-friendly and intuitive. But be aware that some clinicians have expressed concerns about scribe training and documentation quality. So I wanted to kind of mention that. So I can tell you for a fact that we use AI for HBI because, again, it does write a perfect note with your HBI. Honestly, the patient is talking about, rosemary garden or cruises or grandbabies. The AI would not include that in the notes. The AI would just make a record to record just what is necessary for that visit. So again, the scribe of the using AI scribes during the visit, like I said earlier, you just have your smartphone and it's just recording the whole conversation. So the first things first, you want to explain to your patients that you're using an AI scribe, okay? Just very much like ChatGPT, and you want to tell the patient that this will help you document the visit. What that does for you is that you're not typing during the visit, you're actually paying attention and listening to this patient. And the phone, of course, is recording all of that. So make sure you get a consent, okay? That should be done. Your staff should be able to get a consent that this is possible. There would be some patients that will say, nope, I don't want to record it. But during the visit, just revisit that again and say, well, these recordings are really just stored for about 90 days. I know in our own case, just about 90 days, and is discarded. Is really just to improve our documentation, so that way I can pay attention to you when you're talking instead of typing when we're during the visit. So again, be sure to explain to the patient what's going on. You're still using the smart phrases in your EHR to quickly document verbal consent before starting the recording. And then you want to place the phone face down to avoid distractions during the visit. And so you're narrating your physical exam aloud for the AI to capture details accurately. So again, like I said earlier, just think about you having a nurse practitioner student or a medical student in your clinic or in the room with you, and think about them observing you. So you're just telling them what you're doing. That's exactly what you want to tell the AI. This will support better documentation while keeping the patient informed. So again, you're just really using the scribe to get all of your information correctly noted. And so patient safety and clinical considerations, common risk of AI scribes would include missed nonverbal cues and incorrect or unrelated information being added to the notes. So your job is to always go back and look at those notes. These risks are tied to AI hallucination. Actually, that's a word, AI hallucination, because sometimes you're talking about hypertension, the patient is talking about cardiomyopathy, and you're like, no, we didn't talk about cardiomyopathy today. So you need to go back and make sure that you look at all of the conversation that you had, make sure that it's accurate, edit, delete what needs to be deleted. But again, this is a game changer. And then, of course, patients now view their notes, their visit notes through online portals. So make sure that you're revising the notes for accuracy. provide feedback to the patient if ever you have to, if there are any discrepancies or you have to revise the notes. So as AI tools reduce time spent on documentation, you want to track how this would impact your productivity and what would you be doing with all that extra time? Okay, you want to make sure that you're also thinking about it. Now that I'm not documenting, how do I use my extra time wisely? Do you maybe want to put some more, see some more patients on your panel to increase your work RVU or what have you? Again, you have to kind of work that out. But AI would definitely reduce after hours chatting, taking, work home, and all of that. So clinical considerations that you want to think about. So we talked about from your pre-visit planning to AI integration. Efficient documentation is a skill every provider needs to master. You want to make sure you're implementing practical changes such as the dot phrases. So we talked about that. Even with AI, for example, the assessment and plan for most of the providers in our clinic, we still do our assessment and plan ourselves because, again, we want to make sure that we're accurately sending the correct medication. We do not rely on what the AI puts down for the assessment and plan. And remember, we talked about AI hallucination. It's very possible that you could delete some of the ICD codes, right? Again, like I said, you're talking about maybe diabetes and maybe you're just asking questions about, have you had your retinal exam? And the patient will add diabetic retinopathy. Well, the patient doesn't have it. You were just asking the question. So make sure that you go back and look at the assessment and plan, actually the whole documentation with AI Scribe, and just delete and clean it up before signing that note. And then, of course, make sure you're also tracking your RVU. That is so important, especially if you're going to be bonused. Again, you want to make sure that you're on track for your bonus at the end of the fiscal year. And you want to secure patient education, communication, okay? Because again, these can dramatically impact workflow and your outcomes as a provider. So you want to stay compliant. You want to make sure you're connected to your team, and you should be open to technology. This is the way of the future, and this again will really enhance the care that you provide to your patients. All right, so real life talk. I always get this question about, every provider that I see, they say the same thing. Charting takes too long. Templates don't capture what they need. They worry about missing something legally important. And of course, documentation, most providers are just taking, they call it pajama time. So you're going home, you're still documenting. It does steal time from family, rest, and life outside work. So if you identified with any of that tonight, you're not alone. You want to know that is the reason why we created the Efficient Documentation Made Easy course, so that way you can document faster, smarter, and with greater confidence. So I will let Amelia talk to you about the course itself.
Yes, so what you guys heard today is just a small snapshot of the entirety of our course. It does go more into depth. It does give you a more grander scope of everything that has to do with the documentation. As you heard today, there are many tips and tricks and tools that you can use to make the documentation easier and faster so that you can regain your time. Time is very important. If you look here, we do have a couple of the different things throughout the chapters of the course. And also, if you get the course today, we actually have a very special discount for you. So some of the things that we talked about today regarding the efficiency of the documentation, making sure you're getting everything that you need, as well as making the documentation faster by using some of those dot phrases, some of those macros and things of that sort as well. It also dives a little bit deeper into the AI usage. I know we briefly spoke on it, but it gets a more in-depth view of that later on in the course as well. And as always, you get CE hours with the course. So that's always a good perk as well, in addition to the knowledge.
This was so great. The energy in the room was phenomenal. Thank you all for being here.
Hey, thank you so much for watching. If you enjoyed this, there's plenty more where that came from. Be sure to check out similar videos on our YouTube page. And don't forget to like, comment, and subscribe, and we'll see you next time.